Hi, I thought I would do a couple of videos about a couple of consultation models that I think are quite important. First one we'll talk about in this video is the disease-illness model. Now, this consultation model highlights that you can think about the consultation having two separate sides to it. There's the disease side and the illness side. Now, the disease side is the doctor-centered side. It's the symptoms of the disease and what diagnosis you think is going on and the evidence-based treatment plan. On the other side is the illness, and that's the more patient-centered side. How is it affecting the patient in real life? And within that you would include the patient's health beliefs, what are their ideas, their concerns about what's going on, what do they think would be a good treatment options for it, how is it affecting their life. Now, when you strip everything away, the most important thing that I think happens, that the doctor does, is to work out what is the diagnosis or most likely diagnoses of what's going on and what's the best evidence-based treatment plan. That's what doctors should be doing. And that's really what as medical students and then doctors in their early career really be focused on. That's the disease side. And as you become more experienced, you'll start to work out how to ask patients how it's affecting their life and start building in the illness side, understanding the patient more and how they want to be treated. This is obviously really important because, as we all know, compliance will decide how well the patient follows the instructions you're given. If you don't understand how it's affecting the patient, this disease, and you give a treatment plan that the patient does not want to follow, it was pretty much a waste of time, your consultation. Medical students, early doctors of their career, really going to be focusing on the disease to work out what's wrong with the patient. As you become more experienced and your brain starts sort of freeing up to be able to think of other things as well, because you have increased confidence in your consultation skills, understanding what diseases could be causing the scenario and having a better idea of the treatment plans you can have, you can start building in more and more the illness side of things. With the disease-illness model, what it looks at is going from side to side throughout the consultation. So maybe starting with finding out about the symptoms, and then we'll pass across to the illness side where the doctor will try and find out how it's affecting the patient, come back to the disease side, maybe trying to find out some more symptoms to really clarify what the condition is, maybe going back to the illness side again to find out a bit more about what the patient would like to do about it, coming back to the doctor's side, telling the patient what the diagnosis is, going back to the illness side, checking that they're happy with that and was there anything else they were thinking of, going back to the doctor's side, these are the treatment options, back to the illness side, is that something you would like to do? So you can see it kind of zigzags back and forwards from side to side throughout the consultation. Now, probably in most models that incorporate this kind of idea, and I think probably most doctors, as they're developing their ability to consult, will usually concentrate on the disease side, the symptoms, and probably go across to the ICE questions and how's it affecting the patient at the end of their data gathering. Now, what I would advocate to try and start doing, if you can, is to try and bring in that illness side as early as you can. So my consultations, where I tend to consult, will be to ask the early open question and facilitate the patient to talk for as long as possible, which I can talk about in another video. I then tend to follow up with another open question if I need to, for me to really understand what's happening with the condition. Either just another open question to allow the patient to talk a bit longer, or often to find the timeline of events. And again, I'll probably talk about that in another video because that's really important. And then before I start going to more closed questions, I will then come across to the illness side, find out how it affects the patient, what do they think is going on, are there anything they're particularly worried about, their expectations, finding out why on each of those. And then if needed, come across to more closed questions to really work out what do I think the diagnosis is, what is it not. But often you'll find most of those closed questions you were going to do get answered when you're asking the ICE questions. And then obviously from then onwards you're looking at your investigations and treatment plan, incorporating what you found out from the illness. What does the patient think and what do they want? Finding out what they've tried already before you start giving a treatment plan that you think was the one you needed. So incorporating the illness into your treatment options. Okay, I hope that makes sense. Okay.